I can see you are in the meeting. Today we'll be looking at the annual performance plans of the Department of Health and Social Services, including their budget. As we know how important this department is, we will give them 2 hours of presentation, one full hour of presentation, and then we engage, and then 12 o'clock we'll be leaving to join the house. They say sitting in the afternoon at 2. The bus are leaving here at 12:30, so we'll have to keep time. There's the agenda on the table. Any additions to this agenda? If there is none, any move for adoption of this agenda?
I move for adoption of agenda, Chair. It's Nkosi.
Ethel Nkosi moves. Any seconder?
Ndongeni second, Chair.
Ndongeni seconds. Thank you very much. So just reminding members that we need to be very economic with our time, because there's a lot on our plate today. Welcome, DM. Are there any apologies?
Good morning, Chairperson and members, the Minister, DM, and colleagues. Chairperson, I have not received any apologies from our members. However, Mr. Ntsubi has just boarded a flight and he will join us as soon as he can. Thank you, Chair.
All right, thanks. I'm trying to check, is the minister in the meeting? Not as yet.
He is in the meeting, Chair. Good morning. We are led by the minister is present. Thank you.
Oh, okay. Oh yeah, no, I can see. He said, I wasn't seeing his name on the platform. Welcome, Honorable Minister. Let's give over to the department to brief us on their annual plans and their budget for 2023-2024. Over to you, Honorable Minister.
Thank you very much, Chairperson. Good morning to you and to the honorable members of the Select Committee for Health and Social Services. Let me also recognize my colleague, Deputy Minister Jomo, and DG and the team from the department. We're very appreciative of this opportunity. As you've indicated, Chair, that time is really of essence. I'll be very brief in my overall introduction of the presentation of the department. Just to say to the honorable members that we appreciate this and take cognizance of the fact that the 2023-2024 annual performance plan, it's really the first in what we could regard as, in the normal kind of recovery phase of the pandemic. I'm hesitant to term it like other people say, post-COVID, suggesting that it's all over with COVID. We appreciate the fact that this is, the first time in 3 years since 2020 that we're presenting our annual performance plan under almost semi-normal circumstances when the high levels of burden of the COVID pandemic are behind us. We know that the virus is still there. There's still people getting infected, getting sick, but due to the protection from our vaccination and also those who have a natural immunity. Even as people are still getting infected, it's mainly mild, and very few are getting seriously ill to the level of hospitalization. But the pandemic, the virus is still with us. The World Health Organization has not yet declared it completely over because of the fact that in various parts of the world, there are still flare-ups. But this is indeed better times compared to where we were. If we will remember where, the situation we were in 3 years ago, in May of 2020, we're all in a panic as the virus was really spreading and scrambling to make sure that those who are infected and getting sick would be able to be looked after. And that was to be the case, at least for a full 2 to 2.5 years. So, so we would say that this is a situation where we are in a recovery mode because the pandemic derailed a lot of our programs. We know that as a country, we are dealing with what we call a quadruple burden of disease, which is the non-communicable diseases, and then the infectious diseases, communicable, which include the COVID, the HIV, TB, malaria. We also have to deal with a huge burden of trauma and accidents. And lastly, we have to look after our children and our mothers, the improvement of maternal and child health and improvement of health outcomes. So those are the 4 main areas in which, as a department, as a sector, we're focusing on in terms of the whole mission of improving, making sure that South Africans live a long and healthy life, and also improving, making sure that the life expectancy of South Africans progressively improves to reach 70 years average by 2030. So those are the issues we have to deal with. So in this 2023-2024 financial year, which we will be presenting to you, we will be looking at a number of areas in which we have to, the pillars based on which we can make sure that there is indeed an improvement of quality of life, dealing with this quadruple burden of diseases. In terms of the areas of intervention, the issue of improvement of human resources is very key. So you will see from the presentation in terms of where we are in improving human resources for health. We'll see also in terms of infrastructure, where we are, because without infrastructure and equipment, it will not be possible to improve the quality of life. We'll see also to what extent we've taken steps to mitigate against both the infectious and, in other words, communicable diseases, such as HIV, AIDS, TB, malaria. You would see the interventions working with our colleagues in provinces, how far we have gone with that. You would also see, just on that, honorable members will see that we have recently, on the 24th of March, on World TB Day, launched our new national strategic plan for HIV, AIDS, and TB and sexually transmitted diseases, which will guide us over the next 5 years. Not long ago, we also, on the non-communicable disease, we also launched the national strategic plan for the control of non-communicable diseases. So these are some of the ammunition we have as we'll be presenting our APP for the coming year. In the area of human resources, I can just mention a few issues to say that over the last few years, we have stabilized on the human resources. Over the few years before, we always would have an outcry at the end of the year and in the beginning of the year, in as far as placements of medical interns and also community service doctors and other community service professionals. Over the last 2 years, this has been stabilized, and as a result, honorable members would not have had any public outcry in terms of non-placement of especially your medical interns and also community services. Also on the human resources, I can just highlight as I come to the conclusion that also in terms of streamlining the training of nurses, the completion of the new curriculum of the training of nurses, the opening up of the new curriculum in all the 9 provinces. All 9 provinces have now established their provincial nursing colleges with satellite campuses in all the provinces, and the new curriculum is really on the roll now. So with that, just as a highlight, Honorable Chair, we want to say that we are indeed, as we begin this financial year, focusing on improvement of quality. We're grateful that we are no more living under the dark cloud of a huge burden of COVID-19. So we are able to recover in all our work and focus again on improvement of quality of service. And in this regard, we are hoping that the National Health Insurance Bill will be passed by the National Assembly and will subsequently be forwarded to yourselves as the National Council of Provinces. And we hope that equally so, you would help us by passing that into an act so that we can be able to have this equalizer, which will make sure that we start progressively to reduce the fragmentation between what we have, the 2-tier system we're having now of a public health on the other side, on the one side for the majority of South Africans, and the private health for those who have income. With that, Honorable Chair, I'm sure we'll be able to stay within the 1 hour. I'm going to then pass over to the DG to indicate who will be making the presentation for the details of the annual performance plan. With your permission, Chairperson, I'm inviting Dr. Buthelezi, our Director General. Thank you, Honorable Chair. DG.
Thank you very much, Honorable Minister. Thank you very much, Honorable Minister, and good morning to the Honorable Chair, Honorable Members, Deputy Minister, and colleagues. And thank you, Minister, for the opening remarks. I will then hand over to Ms. Sibanyoni, who's going to lead us through the presentation. We will be ensuring that we stay within the time. Over to you, Ms. Sibanyoni.
Thanks, DG. Good morning, honorable members, Minister and Deputy Minister, as well as the National Department of Health colleagues. I am going to take the next few minutes taking you through the annual performance plan for the National Department of Health. As we go into 2023-2024, we are reflecting on the significant improvement in terms of the health outcomes in our country in the past 10 years, with a positive impact of the health status of South Africans who are now living longer, because we have managed to have some gains in terms of reductions in the premature mortality. However, as indicated by the Honorable Minister, we are equally concerned with the fragmentation between the public and private sector, which then really says that we need to ensure that universal health coverage is realized, but this needs to also be supported by the reduction in the relative cost of private medical care, as well as the improved human capacity in the system for the public health sector. Now, in terms of our strategic outlook, which is emanating from our medium-term strategic plan for 2019-2024, we are reflecting on the 2 impact statements. That is the progressive achievement of the universal health coverage, which is to be realized by 2030 through the implementation of the NHI policy, as well as the improvement of the life expectancy from 66.6 years by 2024 to 70 years by 2030. And we're also noting the progress that has been made in terms of the legislative process for the NHI. But as we were developing the plan, we have reflected on some of the key diagnostics that we have taken into consideration, and that will include the Presidential Health Summit report, the Lancet Commission recommendation, the Health Market Inquiry, as well as the South African Demographic Health Survey. Now, in terms of aligning our plans, looking at the MTSF goals and the pillars of the MTSF, some of which in the interest of time, I will touch on a few. Goal 2, which is on the achievement of the universal health coverage. The presidential compact will then enable us to engage the private sector in improving access, coverage, and quality of health service, as well as to improve the efficiency of public sector financial management system, as well as processes. In terms of goal 3, we are looking at improvement of quality and safety of care, and the compact then enables us to improve the quality, safety, as well as the quantity of health services that are provided, with the focus on primary health care. Continuing with goal 3, we are also acknowledging that there needs to be improvement in the availability to medical products and equipment, and this is further enabled by Pillar 2 of the Presidential Compact, that is to ensure that there's improved access to essential medicines, vaccines, and medical products through better management of supply chain, equipment, and machinery. And lastly, in terms of goal 4, which is focused on building health infrastructure, the pillar for the compact enables the execution of the infrastructure plan to ensure adequate and appropriate, well-distributed and maintained health facilities. Now, in response to the mandate from the MTSF, we have identified 18 health outcomes, the first 5 being in response to the first impact statements in terms of the improvement of life expectancy, and the second set of the outcomes are responding to the progressive achievement of the universal health coverage. And as I go through the performance information, I'm going to be reflecting on these outcomes. Now, starting with program 1, which is our administration program, which really exists to provide support service to the National Department of Health, and includes, amongst other, those functions that have been listed. We have a few indicators that we are going to be tracking, and in the interest of time, I'm going to be focusing on those that have a bearing in terms of the province, starting with number 3 on the slide, which is on the management of medical legal cases in the health system is strengthened. In this financial year, the department will focus on developing a draft bill to manage medical legal claims in South Africa, and we have outlined the process that we are going to be following from starting in Q1 until this draft bill is then developed and finalized by Q4. I will then move to the next slide, which is the first indicator is also in addition to the one on case management, where we are looking at the piloting of the case management system in at least 4 participating provinces, and this will be tracked through the reports that are captured by the participating provinces on the case management system that is currently being utilized. We are embarking on a number of health promotion messages, which is aimed at reducing premature mortality due to non-communicable diseases. And in this financial year, we are looking at 100 health promotional messages that are going to be placed on our social media platforms. In addition to that, we are going to have the indicators that are talking to community participation in ensuring that we promote health system responsiveness. And in this financial year, 8 unannounced visits are going to be conducted in our health facilities. In addition to the unannounced visits, we are going to be having health imbizos with communities. And in this financial year, 2 health imbizos are going to be held, and these are going to be in Q2 as well as Q4. I am going to skip the last 3 indicators as they are related to employment equities within the National Department of Health. I will then move to program 2, which is on the National Health Insurance, which is to improve access to quality health service through the development and implementation of policies to achieve universal health coverage, as well as the health financing reform. And under this program, we have 2 indicators, the one being on the development of a model that is going to be used for the primary healthcare contracting unit, which is what we refer to as the CAPS. Once this model for contracting has been developed, it will then be tested in the 9 CAPS that have been identified, and these 9 CAPS are in 1 in each province. In addition to the testing of the model in the CAPS, the NHI program is going to expand the access to chronic medication for stable patients. And in this financial year, through the platform of the CCMDD, 5 million parcels are going to be delivered to pickup points, and we are estimating that on a quarterly basis, 1,250,000 parcels will be delivered to this pickup points for chronic patients. I will then move to program 3, which is a program that is concerned with the development and the support of implementation in terms of the national policies, guidelines, norms and standards for the achievement of targets in relation to both communicable and non-communicable diseases. And this program has quite a number of indicators, so I'm going to take a while just to ensure that I address them adequately. So the first 2 indicators are related to HIV and AIDS, and building on the work that has been done in 2022-2023 of 200 facilities offering HIV self-screening, and additional 140 facilities are going to be offering the HIV self-screening, which is then going to be work that is built on progressively, with 230 targeted for Q1 until the 340 is achieved in Q4. The next indicator is in relation to the reduction of HIV incidence amongst the youth, also building on the work that was done in the past financial year. In this financial year, we are looking at 2,100 primary healthcare facilities with youth zone. The next set of indicators are related to TB, with the first being on the DSTB treatment success rate, which is targeted at 90%, building on 85 from the previous financial year. So we're looking at an improvement of 5%. The following indicator is related to also RRMDF TB treatment success rate, which we are also going to improve from the previous financial year, which was 73%, and we are aiming to improve that by 5%, which is consistently going to be maintained for the rest of the financial year. In terms of the next slide, the first one, again, related to TB, where we're focusing on the number of people that are started off TB treatment, and the target for 2023-24 is 223,654. So this is also going to build on the 190,000 that were treated in the previous financial year. The next indicator is on the screening for cervical cancer, where we are looking at the number of districts that are introducing HPV screening for cervical cancer, and the target for the financial year is 4 districts, and in each quarter we are looking at 1 district introducing the screening. The third indicator on the slide is related to regular monitoring of sexual and reproductive health skills capacity in rural districts to improve access to integrated sexual and reproductive health services. And here we are looking on clinicians that are being trained and certified as competent in the modules that are offered in relation to sexual and reproductive health. And the target is to ensure that at the end of the financial year, 128 clinicians are trained and are certified as competent. The last indicator on the slide is related to the districts, the number of districts which are reporting polyoacute flaccid paralysis detection rate of equals or more than 4 per 100,000 among children of the age of less than 15 years. And in this financial year, we are looking at 42 districts that are going to be reporting as such. In terms of the next slide, the first indicator is on mass drug administration in the schistosomiasis endemic district. And this is going to be for school attending children, and the 5 endemic districts that are targeted have been identified. And from Q1, we are outlining the process that is going to be followed to enable this rollout, with starting with engagements, training, the pilot, and the actual rollout will then, for the 5 endemic districts, will take place in Q4. The next indicator is in relation to malaria, with the outcome for morbidity and mortality due to malaria reduced. And in this one also, we are looking at the targeting the endemic districts, number of sub-districts that are implementing the foresight clearing program. And we are targeting 2 sub-districts to be implementing the foresight program. And once again, the process is outlined in terms of how it's going to be done until the implementation is achieved in Q4. The last indicator on this slide is related to the screening of clients for hypertension, where we are targeting 9 provinces achieving an overall 60% of clients 18 years and above being screened for hypertension. And this is going to be building from Q1 with 30% of clients that are 18 and above being screened. And this is going to be achieved by Q4 with 60% of these clients being screened for hypertension. Similarly to the previous one, the first one on the slide is in relation to the screening on diabetes for clients 18 and above. And also we are targeting that we will achieve an overall 60% for the 9 provinces. In addition to the screening for diabetes and hypertension, we are going to conduct 4 national non-communicable disease campaigns in this financial year, with 1 campaign per quarter with different themes. The first one looking at the awareness on the risk of tobacco and related product use. In Q2, we will look at the awareness on the risk of physical inactivity. In Q3, it will be on prevention and management of diabetes. And in the last quarter, we will look at the risk of overweight and obesity. I am going to then skip to the next indicators, which are related to mental health. And the first one is in relation to the number of new state patients that are admitted into designated psychiatric hospital. And for this financial year, we are targeting 200, which is going to be building on the 100 that was achieved in the past financial year. I am going to skip the next indicator in the interest of time. And the last indicator with regards to program 3, it's in relation to the hospitals that obtain 75% and above on the food service policy assessment tool. And the target is for 296 hospitals to then achieve 75% and above on this assessment. And this is going to be building on the 200 that was achieved in the past financial year. We will then move to Program 4, which is primary health care, which is a program that is aimed at developing and overseeing the implementation of legislation, policies, norms, and standards for a uniform, well-functioning district health system. And in this program, we have the emergency health services as well as environmental health services. In terms of the indicators in this program, focusing on the ones that have a bearing in terms of the province directly, I'm going to do the last indicator on this slide, which is on the number of community outreach services to household for first visit as well as follow-up visit. And in this financial year, we are aiming that 20,500,000 of these visits are going to be conducted. And again, this is building on the work that was done in the previous financial year. This is going to be on average 5,125,000 visits to households per quarter. In terms of the next slide, we are looking at the primary healthcare facilities with clinic committee, and this is also in response to promotion of community participation. And for this financial year, we are targeting that 50% of our primary healthcare facilities must have a clinic committee in place. And this is going to be built on the baseline of 34%, which is going to be progressively achieved to 50% by the end of Q4. The next indicator is in relation to the ports of entry with regards to compliance with international health regulations, where we are targeting 30 ports of entry to be compliant with this regulation. And this is going to be progressively achieved from 8 ports of entry compliance to 30 by the end of the financial year. The next indicator is related to the assessment of compliance with the National Environmental Health Norms and Standard, which is conducted to metropolitan and district municipalities. And in this financial year, 26 of the metros and district municipalities will be assessed for compliance with the environmental health norms and standards, starting with 4 in Q1, which is going to build up until we achieve the 26 by the end of Q4. The last indicator in this program is related to compliance with the regulations relating to emergency medical services, whereby all the 9 provinces will be assessed for compliance with the EMS regulations. We will then move to program 5, which is on hospital systems, a program which develops national policy on hospital services and responsibilities by levels of care and facilitating quality improvement for hospital. It is also responsible for the management of the National Tertiary Service Grant that ensures that planning for health infrastructure meets the health needs of our country. And for this program, I will therefore focus on the indicators that are related to health infrastructure, delivery of health infrastructure, with the one being on the construction and revitalization of primary healthcare facility, which we have targeted for 45 primary healthcare facilities to either be constructed or revitalized by the end of the financial year. The following indicator is similar, but with a focus on hospital, also either constructed or revitalized, and we are targeting 30 hospitals to be constructed or revitalized by the end of the financial year. Lastly, similarly, stemming from the delivery of infrastructure here with work in relation to maintenance, repairs, and refurbishment of public health facilities, we are targeting that in this financial year, 300 public health facilities will have some work done in those areas: maintenance, repairs, and refurbishment. And we, in the public health facilities, we are including the categories that are listed: clinics, hospitals, nursing college, and EMS-based stations. The last program is program 6, which aims to achieve integrated health system planning, monitoring, evaluation, as well as research, as well as, in terms of the last bullet, oversight over public entities and statutory health professional council. So in terms of the indicators, addressing the more relevant one, the last one on the slide, which is on quality and safety of care, improved with the output that we want nursing colleges to be supported to develop curricula for prioritized nurse and midwife specialist training. And this is also built on the work that was done in the previous financial year. For this current financial year, we are looking at supporting all the 9 public nursing colleges to develop a curricula to prioritize nurse and midwife specialist training programs. And this is going to be a process that is done aiming at 3 nursing colleges for the first 3 quarters, and in the last quarter a report will be developed with regards to the support that has been provided to the nursing colleges. The next indicator on the slide is related to the implementation of the National Health Quality Improvement Plan, program, I beg your pardon, with the target that at the end of the financial year, 200 primary healthcare facilities and 160 hospitals will be implementing this NHQIP. This is also building on work done from the previous financial year, and we'll pick it up from Q1 with 50 primary healthcare facilities and 40 hospitals. And by Q4, we would achieve the 200 primary healthcare facilities and the 160 hospitals. The next indicator is in relation to Ideal Clinic, which looks at the number of primary healthcare facilities that qualify as Ideal Clinic, with a target of 2,600 primary healthcare facilities, building on what was done in the past financial year of 2,200. So the process for facilities to qualify as Ideal will unfold between Q1 to Q3, and at the end of the financial year, there will be a peer review that is updated with the outcome of 2,600 primary healthcare being qualified as Ideal Clinic. I will then move to the last slide, which is on the human resource for health, both of them, the first being on providing recommendations on the reviewed community service policy, which is to be finalized. And this process is going to have some consultation between Q1 and Q3, and in Q4, the aim is to have these recommendations being finalized and submitted to the National Health Council for their approval. The last indicator in this program is in relation to the rollout of the Human Resource Information Solution, with the target for this to be rolled out in 30 districts. The work in Q1 is going to start with the change management plan for this process, and for the next 3 quarters, 10 districts will then be able to roll out the Human Resource Information System until we have achieved the 30 districts. Thank you, DG. I have completed the part of the performance information. I will pause.
Thank you very much. With the indulgence of the Chair, can we then invite the CFO to take us through the budget? Over to you, Mr. Paswa Mamukhale.
Thanks, DG. Morning to the Chairperson and the members, Honorable Chair and the members. I'm the Minister and the Deputy Minister, and morning to all colleagues. I will go through the finance. I'll ask Koketso to help me with the slides. On the next slide, Chair, we indicating the total funding for the department. Our total funding for the current financial year is 60.1 billion. We also indicate in terms of the source of funding, where we indicate our voted fund, which is 1.2 billion. And also we having the earmarked funding to the value of 2.5 billion. And also the conditional grants, which is the money that goes to the provinces to the value of 54 billion. And we do also have the indirect grants to the amount of 2 billion. So some of these amounts I will indicate as we're going to present the programs, each program. On the next slide, we're just indicating the same information in terms of economic classification, where we indicate our compensation of employees is funded with 682 million, and also our goods and services, which is 1.8 billion, and our transfers. So in the transfers, Chair, you'll see under the conditional grants, we do indicate the 54 billion, which is the money that goes to the provinces. We also have in the 2 billion that goes to the entities and other NGOs, which will indicate as we proceed. And we also having the the fund for the capital, which is sitting at 1.3 billion, of which 1.2 it's within the infrastructure. As we continue on the narratives or on the reasons, we're just indicating the same reasons, Chair. If you realize that there has been a bit of a decrease in terms of the budget, it's mainly because of the COVID-19 decrease, which I will also indicate as we proceed with the slides. Under our compensation of employees, there has also been a decrease because there was a transfer of Port Health Services function to BMA, which has started with the effect from the 1st of April 2023. And also within our goods and services, that huge decrease of 52% is because of the 2 billion funding on the COVID-19, which has been stopped from the current financial year going forward. And then when we looking on the transfers and subsidies, the 1.9 billion is the same that I've indicated in terms of the transfers to the provinces, which there was a decrease of 1.9 billion, which was the money which was allocated for COVID-19. And also the purchase of a capital asset, there was just a reduction on the allocation of Limpopo Central Hospital, but the money will be allocated back by National Treasury since the project will start the implementation in the current financial year. Chair, when we going through each program, on the first program, which is administration, the total program is funded with 800 million, where we will realize that most of the funding is sitting on the voted funds, and we only having the earmarked funding in terms of the medical legal, which is one of the APP targets, and we also having the SACA program in terms of then supporting the finances. On the next slide, we're just showing in terms of the economic classification, Chair, which is still the same 800 million. When we go to program two, which is NHI, within this program, we do have the health financing of the NHI, and we also do have the conditional grants to the amount of 694, which I'm going to also indicate when I'm going to show where the money goes in terms of the provinces. We also have in the indirect allocations in terms of the non-personal services components, which it covers the patient information systems. It covers the medicine stock system, the CCMDD, Ideal Clinic, internship and community service program, and the quality improvement, which we have indicated in terms of the amounts allocated to each of those sub-programs. And in terms of personal services, we also have indicated the allocation for HP contracting of 88.5 million. On the next slide, the total funding is 1.5. On the next slide, with the same funding of 1.5, we indicate in terms of the economic classifications, which we have indicated per source of funding, and the allocation is still 1.5 billion. On program 3, where we also funding the district health program, I'm also going to indicate towards the end where I'm going to indicate where the provinces, where the money has been allocated to. We're also funding some of the NGOs, including the Lifeline, Love Life, Soul City, Condoms, and STANAG, and also some of the NGOs within the HIV and AIDS. And also within our wooded funds, where we're funding our other programs within the program 3. The total allocation to this program is 24.6 billion. And in terms of the economic classification, we indicating the same. So where you see the transfer, so the transfer, that's the money that goes to the provinces that's sitting on the conditional grants, which will indicate as we proceed with the presentation. But the total allocation for this program is 24.6 billion. On the next program, which is program 4, and the PHC services, the line that I would like to indicate, Chair, is the line under the district health program grant, where we indicate 2.9 allocation to the provinces, which is 2.9 billion. But then the total allocation to this program, you'll see, is 3 billion, of which almost all the money goes to the provinces to support the primary health care services in the country. On the next slide, we indicate in the same chair in terms of our economic classification. So I will just continue to program 5, which is our hospital services. Here we also finding other programs, including the health facility revitalization, which is 1.3 billion under the indirect. So that is the money that is sitting within the national department. Then below, under the conditional grant, we have in 7.1 billion. That's the money that goes to the provinces. And at the end, we also do have the NTSG, which is the National Tertiary Services Conditional Grant of 14 billion. That also is the money that goes to the provinces. So the total funding for the program is 22.5 billion. On the next slide is the same information, Chair, we're just indicating in terms of the economic classifications. And then in terms of program 6 is the health system governance and HR. So within the program, we also indicating what we're funding from the earmarked funding. And mainly what I will indicate, Chair, is the statutory HR, which is the conditional grant that goes to the provinces, where we're finding the training component with 2.7 billion and the statutory HR component of 2.7 billion. Also, then the total is 5.4 billion. And we also, within this program, also finding some of the entities, which includes the OHC, our NHLS, our Medical Research Council, our health, the SAPRA, and also the traditional health practitioners, the Traditional Health Practitioners Council, which we have indicated all the money which we have been allocated to those entities. Lastly, there is a directorate, which is the CCMD, which is the CCOD, where we also allocated the 68 million. So the total funding under this program is 7.5 billion. Then on the next slide, we just indicating the same, Chair, in terms of the economic classifications, which I'm not going to go in detail. So on all the slides, Chair, where I was presenting, indicating the conditional grants. So I'm going to go further and indicate the allocation of these monies to the provinces. With this first one is the conditional grant, which is a district health program grant, where we're having the HIV and AIDS, and also the district health component, where there is an oncology, the NHI. So I just went to the next slide. Actually, the two slides are the same. The first one is just the consolidated picture, but I'll concentrate on the next slide, Chair, which it has the two components, which you'll see the total allocation is 26.8 billion. So we indicate in terms of the money that we allocated to the different provinces in terms of the Eastern Cape, 2.7, Free State, 1.7, Gauteng, 5.2, KZN, 6.4, maybe without reading each province. Then you see that the money that has been allocated within the HIV and AIDS component is 23.9 billion. And then under the district health component, also when we indicate per each province, you'll realize that the total allocation is 2.9 billion. Therefore, we're having the total allocation to the provinces of 26.8 billion. When we continue to the National Health Insurance Grant, the total allocation is 694. So it's the same as what I've indicated, Chair, when I was presenting the program too. So the total allocation per each province, we have indicated all the allocation that we have done to the provinces. On the next slide is our Rewind, which is the funding for our infrastructure in the provinces. It's sitting under the program 5. We have indicated the allocation of 7.1 billion. So those are the monies, Chair, that we have allocated to each province, which it tops province is Gauteng with 1.4 billion, followed by, it's KZN with 1.4 billion, followed by Gauteng with 1.1 billion. And also the other provinces follows in terms of all the monies that have been they've been allocated for the infrastructure delivery. On the next slide, we indicating in terms of HR and training grant, the monies that have been allocated to the total of 5.4 billion. So the members will be able to check in terms of each province how much has been allocated, but Gauteng is having the 1.8 billion, which is the most allocated province. That's where I end the presentation. Thanks, teaching. So I'll hand over back to you.
Thank you very much, CFO. I will then hand over to our Honorable Minister. That is the presentation, Honorable Chair.
Thank you very much.
No, thanks, Chair. That's the presentation. As you can see, as I've said, that the various pillars of strengthening the health system in terms of dealing with, on the communicable diseases side, you will see quite a significant amount which is allocated for the fight against HIV, AIDS, TB, and STIs. Also, you'll see on the human resources support to all the provinces, the infrastructure. So that is it. I think we are ready to engage with the honorable members. Thank you for your time, Honorable Chair. Thank you.
Yeah, thanks, Honorable Minister. Honorable Minister, honorable members, there's the presentation from the Department of Health on their annual performance plans, including their budget for 2023-2024. And Honorable Minister, I just want to what we are doing with the Department of Basic Education. We decided that all the provincial departments should come and brief the committee on their annual performance plans and their budgets for the year. This helps us in a way to be able to monitor the departments, the provinces, using our teams in the NCOP to do that. And I was just thinking that maybe we need to look at in the future having this provincial departments of health coming to present their budgets to their budget and APPs to the select committee here. I think that will help us, to check to even help you, for instance, in the national department, you know, in resolving some of the challenges that the provinces are facing. And amongst them is financial accountability, you know, budget management, and sometimes inability to meet and even implement, I mean, the budget that they've drawn, and at the same time, fail to implement plans that were designed by them and put by them on their program, that these are the things that we'll be doing in the next financial year. It's so strange. How do you set yourself goals? And then from there, you can't even explain why you could not achieve those goals. And I think we need to, as a committee, in our next meeting, when we're on our own, we have to look at how do we extend this one of education to also health. I just want to check from your side that what mechanisms do you have in place to support provincial departments to ensure that they improve their expenditure and get better audit outcomes in the future? You know, how are you helping them, and how are you going to do that in the future? From your presentation and from what I know generally about health is that primary health care plays an important role in, you know, helping to prevent diseases and inform communities also on healthcare and how, you know, hygiene and other things. But I can see that the budget of primary health care, it doesn't give confidence because I think it's going down bit by bit. There've been serious budgetary cuts on primary healthcare. What is this that we are doing to ensure that we do not, you know, because regressing on primary healthcare will mean that the death rate in the country, we are going to lose very many people if we do not put lots of energy behind primary health care. I just want to check for myself as a person come from Limpopo also that the Limpopo Central Hospital, how far are we with implementation of this program? At what level of construction are we? Are we at 50%, 70%, or are we still at 3%? Where are we? And by when can we say that this program will be done? Honorable members, that's the input by the department on their budget and APPs. It's your turn for members to engage with the presentation. I can see from my screen, I have Honorable Christians, there's Honorable Lutuli, Ndongeni, and Honorable Baha. In that order, honorable members. Yeah, over to you.
Thank you very much, Chairperson. Chairperson, I have a few questions, and the rest I will obviously hand in for a written response. But my first question is in regards to the health patient registration system. Now, it was reported to us now that approximately 50 million people are registered. My question is, how was this done? Has there been a media campaign? Have they been working with the Department of Home Affairs? And is there a database? Because in the Northern Cape, at the Robert Mangaliso Sibukwe Hospital, the hospital keeps losing the files of patients, and this is further delaying vital patient treatment. Just recently, a patient who has been going to the hospital since 2019 has lost her patient file for the 4th time. And this is a patient whose treatment has been delayed for 4 years, 5 years now. And additionally, one of the findings regarding the medical legal cases is the impact poor administration has when no file or any documentation can be found. Now, this forces the departments to make expensive out-of-court settlements. Now, how is this being addressed? And is the hospital in the Northern Cape, specifically the Robert Mangaliso Sibukwe Hospital, who is in such a terrible state, are they on the cards to get their health patient registration system updated? I just need an update very urgently on that case. Then with regards to the department's report on the backlog on forensic mental observations. So they reported 1,543 people who are awaiting forensic mental observations. Now, what is being done about this backlog? Surely this is a huge problem. When will this backlog be cleared? And what plans are in place to clear this backlog? And then I think we all know, because there have been numerous reports about the severe and acute malnutrition, also compounded by the fact that the country is in such a dire economic situation. Now, what is the Department of Health doing in terms of assisting especially infants and young children in communities to combat the severe acute malnutrition? What are clinics doing to assist parents, mothers, when they come to the clinics? Then we heard that the department is planning I don't know if they said an announced or an unannounced visit to facilities, which I think is excellent. I just want to know by the department if the Robert Mangaliso Sibukwe Hospital is on the cards to be one of those hospitals to be visited, because that hospital is on the brink of collapse. And if that hospital is not on the cards, if the minister and his department can please include that hospital as part of that announced visit. Then with regard to the backlog of obstetric surgeries. Now, I know that this is a national issue, but once again, because I serve on the NCOP for the Northern Cape, I'm going to come back to the Northern Cape. Now, recently I found out that at this very same hospital in Kimberley, there is a backlog of as much as 300 patients with regard to obstetrics in Kimberley. Can the department give us feedback on that? I want to give one example, not actually only one example. I've got 4 examples. 4 women recently contacted me who are awaiting urgent cancer treatment at this hospital since 2019. Now, recently, these 4 women arrived at the hospital. They slept in the passage for 4 days, awaiting surgery because there was no beds available. When eventually on the 5th day, a bed was given to each one of them, and in fact, they were even put on drips. The very next day, they were told that they had to pack up their goods and go home because the surgery was no longer available due to various problems at the hospital, including a lack of staff, a lack of facilities, a lack of materials, etc. And these are patients that are waiting, amongst others, for urgent cancer treatment operations. And I really think it's time to address this problem, especially for the women in the Northern Cape. Then I want to just go to program 6 quickly. So I want to know about the COVID-19 vaccine, which was also reported to us now. So if the department can give us an update, because I know the minister said we mustn't say post-COVID, because obviously COVID is still ongoing, as we've heard. But how much money has thus far been allocated to the COVID-19 vaccine? Is there a database? of the amount of vaccines that are still in stock? Is there a database of those that have expired? And can the department give us an update of the numbers in the country who have recently been vaccinated? That is this season. Additionally, how much money was lost due to the non-uptake of the vaccine in the past 3-4 years? And how many of those vaccines are expired and had to be done away with? And then the HIV self-screening, it's a very interesting program, and I think also one that is welcoming. I just want to know by the department, how will it be done? Where will it be implemented? Which provinces? And how will this be communicated to the public? Then we've also heard in media reports that there have been stockouts of antiretrovirals, and more concerning, stockouts of other medicines like diabetes, hypertension medicines, etc., especially at clinics. So often patients go to clinics and they are told to go home because the stocks have not arrived yet. So what is being done to assist, especially clinics and the smaller hospitals in the rural areas such as Berkeley West and other smaller rural places, so that they can procure their medicines on time? So what measures is the department taking to mitigate the impact of medicines not being available to patients on time? Then with regard to the rise of the non-communicable diseases, we've heard that hypertension is on the rise, diabetes, arthritis, and so on is also on the rise. This in comparison to the HIV, AIDS, and tuberculosis, etc. The question is, how is the department planning to address the rise in this non-communicable diseases? And especially my concern is clinics adequately capacitated and equipped to deal with the rise in this non-communicable diseases? And if not, what is the department doing to assist these clinics? Then we also heard about the district health program for HIV, AIDS, TB, malaria, etc. Now, it is very concerning, and I think the chairperson also raised the problem, is that the budget has declined in the 2023-24 to 26.8 million. And this shows a decrease of 7.6%. Now, this is concerning. I want to know, how will this impact the treatment regime such as mother-to-child transmission, ARV treatment, home-based care, which has recently become huge in provinces, etc., and what is being done to assist there? And then just my last question with regard to the finances of the department, what mechanisms are put in place to support provincial departments to ensure that they have an improved expenditure for better outcomes, because many of the provincial departments are still battling, and year after year plans are put into place, and yet we see no significant improvement in financial audits. Thank you very much, Chairperson.
Thanks, Honorable Christian. Honorable Ndongeni.
It's Honorable Luthuli, Chair.
Luthuli. Honorable Luthuli.
Yes, are you coming first to me?
No, you can.
Okay, thank you so much. Greetings, everyone, and thank you for the opportunity. Chairperson, I have a few questions. Can the department please tell us what are the measures being put in place to deal with the future strikes in the public health sector following the NEHAWU strikes that took place in March 2023? And can the department also give reports on progress of rollout Ideal Clinic? What budget is located for this program? I would also like to speak on the shortage of medicine, especially in rural areas, Chairperson. Minister, we know that a majority of the people in rural areas, they travel long distance to go and collect their medication. And then when they get to the clinics and there's no medication, it then becomes a problem. And also I want to touch what Honorable Christian just spoke about your plan to visit the clinics or the health sector. but I would like to make a proposal that can the department do the unannounced visits, especially on rural clinics and hospital in KwaZulu-Natal, and also how much is dedicated for the maintenance of the infrastructure and equipment. We know that our infrastructure is falling apart, so I would like to know how much is dedicated for the maintenance of the infrastructure. And also the last one, how is the maintenance contracts are going to be monitored to prevent fraud and corruption from taking place? Thank you so much. Chairperson, I am done.
Yeah, Honorable Ndongeni, it's your.
Thank you, Chair.
Mm.
Morning, Minister, morning, Deputy Minister, morning, officials, morning, members. Thank you for the presentation, but we have some few questions we want to understand. Maybe you have said so, but we didn't understand. I'm not quite sure. But my question is from NHI program only has 2 indicators, down from 4 in the previous financial year. This is inadequate for the budget of 1.5 billion and does not cover the scope of the program. Why were the indicators reduced? That's my first question. The second one of indicators is called a new indicator, which is 5 million parcel delivery to pick-up points. Yet in previous years, there was target on 5.5 million patients registered to receive medicine through the central chronic medicine dispensing and distribution. Why was this indicator changed? What has the department learned from the COVID-19 pandemic, and how this learning be incorporated in the running of the department and the design of the NHI in particular? If you can, department update us on the process of medical aid beneficiary being registered on the HPRS. Okay, and then if they can provide with an update on the spending of the NHI grant and grant deliverables in terms of outputs and outcomes in NHI. Okay, the last one, Chair. Oh, okay, I've been covered about the cancer. Okay. And then the last one. What has been in the impact of the COVID-19 pandemic on HIV and TB in the country? How is the department mitigating the impact? Thank you, Chair. I will come back if I have time.
Chairperson, sorry. Can I just ask Honorable Ndongeni just to repeat the one before the last? I missed that one. Before the last one, there was one other issue.
Can you repeat the question before the last one?
Before the last one, okay, Chair.
Was it about the cancer and what you said?
Not about the spending of the NHI grant and grant deliverable in terms of outputs and outcomes. Is that so?
Okay, just
you
say
had a question.
so.
I say if the department can provide the committee with an update on the spending of the NHI grant and grant deliverables in terms of outputs and outcomes.
Okay, no, that's fine.
Yeah, that is the question, Madam Minister. The next questions will come from Honorable Baha.
Thank you so much, Chairperson, and also thank the department for the clear presentation that they've given us today. But Chair, I have a few clarity-seeking questions. One, the AG of SA has in recent years found that information or data provided in the department's annual report were unreliable. Other than removing performance indicators from the report, what steps have been taken to improve the reliability of expenditure and performance information? The second one, Chair, can we get a report on the current situation of the forensic chemistry laboratories, especially with regards to the case backlogs, infrastructure needs, and staff vacancies and morale? Have issues identified in previous years been addressed? The third one, Chair, can the department give us an update on the Northwest Health Department that was put under administration in April 2018? Fourthly, can the department update us on any action taken following the SIU report in COVID-19 procurement? And lastly, Chair, what is the department doing to mitigate the impact of fire at Charlotte Maxeke Hospital on cancer treatment? That was the last one, Chairperson. Thank you so much.
Thanks, Honorable Baha. It is indeed our worry, like I said earlier in my opening remarks, that the performance of provinces, it's worrying us, because that also affects the national department. But anyway, are there other questions that members would like to ask?
Yes, Chair.
Luthula, I can see your hand is up, and
just to add, Chair.
Yeah, just take your hands, put your hands down.
Oh, okay.
All right. Mister, let's hear responses from the department.
Thank you very much, Honorable Chair. Can I maybe just ask DG if you could maybe yourself and the team, and then I think myself and the Deputy Minister can come later. If you could, I'm sure you've taken note, and you can allocate those which you can deal with, and then allocate others, and then myself and the Deputy Minister can come in after that. DG.
Thank you very much, Honorable Minister, and thank you.
The lights are off in Acacia Park, so please bear with me. There are some challenges. Yes, you may continue that.
No, thank you very much, Honorable Chair and Honorable members, for the questions. I will deal with a few questions, and then I will then hand over to the supporting team from the department to deal with specific questions. I think, firstly, I want to start by plans to help provinces to improve audit outcomes. Through the CFO's forum that we've put in together, our national team is working closely with the provinces, and we do also work with the South African Institute of Chartered Accountants, which is called SAICA. We have a project where we actually deploy resources based on need in provinces to work with the teams there to ensure that there's proper financial management, but we also address the issues of audit outcomes. And recently, we've also had a big meeting with all the provinces, the Auditor General, And we've gone through the generic issues in different provinces that are actually leading to adverse outcomes. So that's the kind of work that we are doing with the provinces to ensure that we are able to deal with the adverse outcomes. And we hope that we will be reaping the good results in terms of what needs to be done at that level. Then the next question I would like to deal with is the issue of Limpopo Central Academic Hospital. This hospital, the contractor has been appointed and even introduced to the province, and they're currently setting up the site in the province to start with the construction work soon. So they will be in construction within the next 2 months. They are setting up now. And the anticipated date of delivery of this project is 2028. Then the next question that I would like to deal with directly is the issue of the COVID-19, the vaccination program, as asked by the honorable member. Firstly, I just want to say that currently we have at the central warehouse, we have 21 million doses of the Johnson & Johnson vaccine and 7.6 million doses of the Pfizer vaccine. No stock has been written off at the central warehouse due to expiry currently. Through SAPRA, we've been getting extensions, which is done independently of the work. And then in terms of the actual procurement, we have not procured any vaccine. Recently, we only procured initially when we procured, and the total cost that we spent, it's from what I have, is 9.1 billion that was spent to procure the vaccines, and we've not procured any vaccines we procured. So we're still dealing with the initial contracts that we procured, because we had actually procured in bulk at that particular moment in time. Currently, in terms of the vaccinations, we have about 38.8 million people that have been vaccinated in terms of the recent information that we have with us to date. In terms of the next one that I will deal with directly is on the issue of on the NHI indicator.
Yeah,
Why did
DG, before you pass,
yes.
I think, just so that we don't come back, I think that 38 point something million should be doses rather than persons, I'm sure.
Yes. Okay. Oh, no, thank you very much, Minister. Yes, it's the doses. I really appreciate, Minister. Thank you very much. And then on the issue of the indicators that we dropped on the NHI, the main issue was that some of the indicators that were put into the APP before are actually dependent on the passage of the bill into an act that we will not be able to implement until the act has been assented to by the president. So hence we found it very difficult, because that process is out of the hands of the department, but is in the parliamentary processes. So that is the main reason that we had to take down some of those indicators. But I will allow Dr. Thulare later to come in and deal with the other issues in terms of the national health insurance. Then through you, Honorable Minister, I would like to request that I invite Dr. Thulare to deal with some other questions that are related to the national health insurance. They were very specific questions. She will then be followed by Milani Volmarans, who will then deal with the questions relating to HPRS, record management, and the plans for the department to improve the issue of record management in the facilities through the digitization that we are involved in. After that, I will then request I'll then request Mr. Takela to come in and deal with the issue of infrastructure and the funding that is available for maintenance, and how are we ensuring that there is no fraud in terms of management of contracts. But he will also then deal with the issue of Charlotte Machege in terms of the progress there. Following Mr. Takela, I will request that we have Ms. Jeanette Hunter to deal with the PHC-related questions, including the rollout of ideal clinics, the shortage of medicines in clinics, and all the other questions that we have on the non-communicable diseases. How are we addressing this as a department moving forward, but also on the issue of PHC as asked by the chair of the honorable chair of the committee. She will deal with that question. And then I will have the CFO to talk on some funding related matters. I've addressed some of them. And then we will revert back to our minister and deputy minister. Over to you, Dr. Tulare.
Good morning, DG. Good morning, Minister, Deputy Minister, Honorable Chair, and Honorable members. I am going to provide some responses to the questions that were raised in respect of NHI. The first question, DG, I am going to request on electronic health records and the Robert Sobukwe Hospital in particular to be responded to by Ms. Milani Volmarans. And then in terms of the indicators that have gone down, I think DG, you have already started responding to that by indicating that the previous indicators were based on activities that depended on the NHI legislation being passed. And in our discussions actually with the Auditor General, they did find that, the indicators were not smart enough because there were lots of dependencies. And it was agreed that, these indicators at this point in time, before the NHI bill is passed, and we can actually do the purchasing based on the legislative imperatives, cannot be used to measure our performance because they depend currently on what happens in Parliament, and the department does not have control on what happens in Parliament in terms of the passing of the legislation. We have changed the indicators to two smart indicators that can be measurable and can be accounted for. The first indicator that makes reference to the contracting units for primary health care, and 9 of them being established in the 9 provinces, is a tangible activity that we have full control over and that we can describe properly and implement. So that is the reason for the first indicator. And for the second indicator, it will respond to even the question that was raised around why we have moved in terms of the previous indicator on the CCMDD to this new indicator. What has happened is that previously the CCMDD indicator was measuring cumulatively what has been happening over the years, and it was not giving a precise indication of what we want to achieve with the CCMDD. It was just giving you numbers that so many people are receiving medicines through CCMDD. Now we have changed that indicator so that we look at how delivering of medicines through the CCMDD program improves access to ARVs, improves access to non-communicable diseases medication. So it becomes smarter, and we can therefore account to the AG as well in terms of what improvements we are making, instead of just measuring cumulatively the numbers without looking at the actual impacts of our interventions in respect of CCMDD on health outcomes of our population. So that is the reason why we have changed the indicator, and that is why we have also reduced the indicators. Actually, on CCMDD, the Auditor General and National Treasury were also not happy that we're just using cumulative numbers to look at our indicators. In terms of how many medical aid members have been registered on the HPRS, we register people as they come into our facilities. But in particular, in respect of medical schemes members, there is a problem that currently exists between how the Council of Medical Schemes regulates medical schemes and the information that we are collecting from that. One of the sets of information that schemes are refusing to share with Council for Medical Schemes, which is the regulator, is in terms of allowing us that database that gives us in detail medical schemes members so that we can transport that into our HPRS. And they are saying that, you know, there is a lacuna in the Medical Schemes Act that does not allow the Council for Medical Schemes to collect that information from schemes. And therefore, as we are moving towards amending the Medical Schemes Act, that area of conflict in terms of CMS being able to collate this information is going to be addressed, and we are going to address that process. But during COVID and during the era of vaccination, there was an attempt actually to get more of the information. And one of the challenges that we had experienced is that because of the lack of this database, as schemes are refusing to provide it because they believe that it is their competitive advantage, we have found that, you know, we could not even get a proper, you know, a recording of who is being vaccinated, but we had to find alternative ways of confirming the people that are being vaccinated so that we could align with the vaccines that had been administered. The last question is really in terms of our NHI grant expenditure versus the grant deliverables. What normally happens is that as we prepare, you know, our grants on an annual basis, we have plans that we work on together with a National Treasury on how the grants should be performing. And if you look at the number of grants that we are working on, there are quite several in number. And basically, what the grants are aimed at achieving in terms of the performance is to prepare the health system so that we could implement NHI in a seamless way. And if you reflect on the presentation that was made by the CFO in terms of the types of grants that we have that fall under NHI, you will note that some of the grants are aimed at addressing, for example, the issue of, even though they are not quite specific to NHI as a fund, but they are looking at how we could improve the services in terms of patient information system, which relates to the health patient registration system and the general patient electronic health information system that we are currently working on. We are also working on the stock medicine stock system, which gives us an idea of our stock visibility and which gives us a sense of whether, you know, we are managing, you know, what used to be a complaint about drug stock outs. And we have an up-to-date set of information that gives us an idea of where the shortages are. And just to indicate that, you know, also indirectly responding to a question that was raised about medicines running out in rural areas, our stock in visibility system does not indicate that, you know, there are dire shortages, but there are pockets of shortages that when they emerge, we address them instantly. There is a grant that is related to the CCMDD, which we have spoken to, and that grant is aimed at ensuring that we deliver medicines closest to where the patients are. We reduce the number of people that are queuing for repeat medicines in our facilities, and thus making it easier for our pharmacies to cope with medicine requirements for people, especially those that require repeats. We have a grant which is indirect that deals with strengthening of our ideal clinics, and that is directly related to ensuring that, you know, at a primary healthcare level, which is going to be the heartbeat of NHI, services are appropriate and our ideal clinics are delivering what is expected of them. Then there were two other grants that related to human resources in terms of internship and community service program. And those grants were supporting the program on human resources that because we did not have adequate funding to fund some of these programs. And this was to top up the gaps that were identified. And on quality improvement, it's very, very important that we improve the quality of services that we deliver in our facilities, whether it's at hospital level or at a primary healthcare level. And this grant, in terms of its purpose, is to make sure that in readiness for NHI, we start improving the quality that is delivered in our facilities, because NHI, by its nature, is aimed at ensuring that we deliver quality health services to everyone, irrespective of the socioeconomic status from which they arise. And the last area that I just wanted to make reference to in terms of the grant, it's in terms of how we are going to be working on the capitation system, which is going to be the backbone also of contracting for services at a primary healthcare level. So the grant, the indirect grant on capitation, is aimed at testing some of the interventions that are going to be undertaken to make sure that NHI operates in a manner that I would like to see it operating. And also there has to be some research conducted, including on testing activities such as diagnosis-related groupers, but also in terms of getting people employed who are going to be in a position to conduct this research. The last area, Minister and Honorable Chair of the committee, it's around what we have learned from COVID in terms of preparing for the NHI. And what we have learned from COVID is that, the health system has to work in unison. We cannot have a health system that is working in silos. And COVID taught us that as we plan for NHI, we must endeavor to ensure that we unify our health system and we benefit from both the public and private sectors in terms of how our services are delivered. And that is what we are testing, including in our contracting units for primary healthcare, and also including in other activities that we are researching on to take NHI forward. Thank you, Honorable Chairperson.
Thank you very much, Dr. Thulare. Milani, please come through.
Good morning, Honorable Minister, Deputy Minister, and members, and colleagues from the department, DG. With regards to the outpatient registration system, just to give some general feedback and then to zoom into the Northern Cape and Robert Mangaliso Sobukwe Hospital. So as from 2014 to 17 April 2023, the total number of individual registrations, not individual persons, individual registrations that is recorded onto the HPRS is 65 million, just over 65 million individual registrations. The solution has been installed into 3,205 public health facilities. I'm giving this background just to say, just to indicate in terms of the journey that we have embarked on towards digitizing of electronic health records, which is really a journey that you need to undertake in order to ensure you take everybody that's involved, from the person working in the facility to the manager, to the IT support, to the hardware, to the different technologies, and the standardization of different processes so that we could have a shared electronic health record. So what the HPRS is doing, it assigns a unique health identifying number to an individual. And once the electronic health record has been rolled out, if a person would go for a consultation and some blood tests at Springbok Hospital, to use the Northern Cape as an example, and is being referred to then Kimberley in terms of the Robert Sobukwe, Mangaliso Sobukwe Hospital, then the clinician there will be able to directly see those results, or would be able to access if there has been any x-rays, or would be able to see what was the interventions that the clinical interventions at Springbok Hospital. And in order to do that, you need to have what is this unique number. And in technical terms, it's called a master patient index. So the intention is that for you also in preparation of NHI, that every individual person that would access services under NHI would have a master patient index allocated to them. So currently we didn't use a national database. Like Dr. Tulare has mentioned, people are being registered on the HPRS as they are visiting a facility. However, we've got more registrations on HPRS that there is currently people living in the country according to Stats SA. And the reason for that is that based on our monthly verification with the database of Home Affairs, people have died. There's also people that has left the country. And we also know that there are people that is undocumented that's accessing our health services. And currently it is not required for a registration that the person needs to bring a form of an identity, because just to prevent and make sure that people can continue to have access to services, because the system should never deny a person access to health services. So currently we are working with the Department of Home Affairs, and we should have what is called in technical terms again, they call it the minimum viable product, but just practically, we should be in a position to test where the HPRS will be able to directly verify with the live, with the population database of Home Affairs as a person visits the health facility, but it will also be able to verify biometrics through the fingerprint identification on the harness/ABIS system of the Department of Home Affairs. We've purchased equipment. We will be implementing this then in at the moment in about 300 primary healthcare facilities to do that, what we call just the first test, and then we will scale it up across the country. So that's how we work with the Department of Home Affairs. In terms of the hospital, Robert Sobukwe Hospital in Kimberley, the HPRS is installed in Robert Sobukwe Hospital. We have picked up through our monitoring processes that there are challenges, and we are currently working on a plan with the Northern Cape Department of Health in order to look at what is the issues and what is the required support that we can provide, so that the HPRS is not only being used as a patient registry, but also as it has been designed to use as a patient filing system. With regards to the electronic health record and what we call a shared electronic health record or a portable health record. So in other words, a record that follows the person. So it doesn't matter which facility you are visiting, the record will be available to the clinician that will tend to you. It will take us approximately 5 years to do the development of a fully fledged electronic health record for South Africa, therefore fully digitize all clinical records of an individual. We're starting this year with a very focused module, and we'll use a modular phase approach over the 5-year period. It's all resource dependent. It is very costly to develop this, but also to roll it out and to facilitate the change management. because you can have the best solution in the world. There's still people that needs to use it. And that we've learned from the electronic vaccination data system. And we learned many lessons from EVDS. And we're going to capitalize on that and introduce the first module of the electronic health record. And the first module will focus on TB and HIV. There might be a question, why TB and HIV? So currently we do have a record with our system that reached its end of life for specifically HIV. And there's a lot of low-hanging fruits that can take us forward quickly in terms of introducing that module specifically for HIV and TB, and then we will build on that going forward. We're also in the process of evaluating and looking at a solution specifically as a hospital management information system and how that can be taken to scale throughout the country. Again, it's a journey. And we are working very hard to ensure understanding the frustrations of our people with the fact that they can't get their files and they're being sent from pillar to post and so forth. So from our side, we are working with the provinces. We're also working with the private sector so that we can take this forward as quickly as possible. It is, however, resource dependent. And just to give an indication, our estimate is to develop a fully fledged electronic health record for South Africa over the 5-year period will cost us 1.5 billion rand. And that's just the software development, not the implementation. One of our biggest challenges is connectivity. And also now the load shedding also plays a role in terms of the digitalization and the use of the HPRS. Thank you, teacher. I think I've answered all the questions, and Dr. Tulare did answer the issue around the medical aid.
Thank you very much, Milani. May I invite Mr. Dagela to come in on the infrastructure maintenance and the budgets?
Thanks, DG. Thanks, DG. Good morning, Minister, Deputy Minister, and the honorables. DG, you have covered the Limpopo Central Hospital. I just want to kind of like to highlight that the contractor, yes, it has been introduced last week, and we have just received a permit to work on the site from the local municipality. And the actual budget for the work is 3.9 billion. And the site handover is scheduled for the 10th May 2023. So that's basically the feedback on Limpopo Central Hospital. I must also emphasize that there's going to be more jobs that are going to be created within the province when it comes to this project. And then let me give a response to Honorable Luthuli in terms of the maintenance budget. Let me then just cover that the maintenance budget does not come alone. There is also a budget for upgrades. There's also a budget for rehabilitation of the hospitals and also renovation of hospitals. So let me give a 3-year budget starting from 2023, 2024. For the maintenance alone and repairs, the budget is 3.4 billion that has been set aside. And then for the renovations, the budget is 2 billion. And also for the upgrades, the budget is 1.7 billion. So if I go to 2024, 2025, the budget allocated for maintenance is 3.2, which is a bit below. But the renovation budget is 2 billion, and also the upgrades, the budget for the upgrades is 2.1 billion. Those two are a bit up a bit. And then if I go to 2025, 2026, the budget for maintenance and repairs, the budget is 3.6 billion. And then the one for renovations of the facilities, the budget is 1.6 billion. And the one for the upgrades, the budget is 2.4 billion. So in total, the budget for the next coming years is 22.3 billion that has been set aside for both maintenance and repairs, renovations and upgrades. So basically, those are the budgets set aside to improve the conditions of the facility, of the health facilities. And then also still on Honorable Tuli, you asked a question, how are we going to make sure that the provinces are complying when it comes to managing this budget? The department is planning to invest more time in monitoring and evaluation, which is important. There's a saying in English, people, they don't do what is expected. They only do what is inspected. So we'll be making sure that we are inspecting each and every phase. We are inspecting the procurement phase of this, the procurement phase of these maintenance activities. We're also making sure that we monitor the performance of the contractors. It's been lacking, I must say. We need to make sure that we are visible, we're monitoring the contractors, the way they do work, and also making sure that the quality of work is improving, because in most cases, most of the contractors, they don't do what is required. They kind of like do whatever that they want to do. So we want to emphasize oversight during the next 3 years, making sure that there's compliance. To come to Honorable Baha, let me then give a feedback on Charlotte Maxeke. I wanted to share when we took over this project last year, we came up with work packages, and we've got about 5 work packages. The package number 1, it has to do with a new dry store. Their dry store was no longer fit for purpose, so we had to come up with a new dry store for Charlotte. And then the A&E, which is block 1, it was also not working out, and then we took over the work that was required there. And then work package 3, it had to do with the detailed structural damages. Remember, there was a fire that damaged some structures within the hospital. We had to come up with that work package. And then we had to come up with work package 4 that talks to 2 things, the temporal access to parking, and also the other part, which is the remedial work that is required to block 4 and block 5. And then the work package number 5 is the facility-wide compliance, making sure that if there is fire again within Charlotte, that fire will be prevented from spreading further. So let me kind of like give a status on work package 1. Work package 1 is completed. It was completed last year in April. And then work package 2 that talks to block 1, which is the A&E. That package, that work was also completed last year, March, and I opened it myself. I was there, the minister was also there. And then work package 3, the one that talks to the structural damage, the assessment that was done, that was supposed to be done. The University of Stellenbosch came on board, assisted us in terms of analyzing the structures of the areas that were caught by fire. So that part was done, and it assisted us to map up what is required for work package 4, which is block 4 and 5. And the temporal access that was required for work package 4, that one was also done last year. And then the last one, which is kind of like work package, also within work package 4, the one that talks to the remedial work for block 4 and 5. That's the only item that is due, which is supposed to be done by 31st December 2023. The additional work that is within work package 5, the one that talks to compliance, is an additional work to ensure that the Charlotte Maxeke does not kind of like get this type of fire in the future. So the fire compliance system is going to come with preventative mechanism to ensure that there are fire detectors, to ensure that there are fire sprinklers that are working, to ensure that there is a fire system.
Please summarize. Dagela Chair has indicated time constraints. Just to give a summary.
So basically, so that work is going to be completed, the additional work is going to be completed in 2026. So that's basically my feedback, Chair. Thanks, DG. Thanks, Minister.
Thank you very much. Jeanette, please, if you can just be strict with time.
Good morning, Honorable Chair, Minister, Deputy Minister, DG colleagues, and honorable members. I'm responding to the question of the shrinking budget of primary health care. So as a department as a whole, we needed to reprioritize within an existing budget, which, as the chairperson and the members have pointed out, has shrunk overall in any case. So the chair is right when he says, and Dr. Tulari has also said, that primary healthcare is going to be the flagship of the health system going forward. But the increase in funding to primary healthcare.
I wanted to say, I just went ahead and
said it.
There's somebody there who's interfering. Can somebody mute anybody who's not on the platform, please?
Thank you, Minister. The increase of funding to primary healthcare is going to be like a sliding scale. The more we are able to improve the health of South Africans, the more funding we can take from higher level curative services and bring it back to primary healthcare. Fortunately, we do have the health promotion levy, and as a department, we need to start using that levy more aggressively, make sure we get a bigger proportion from Treasury and spend that on the health promotion programs, which will educate South Africans about keeping themselves healthy. In the meantime, Chairperson, we do have priorities such as surgery backlogs. We do have a commitment to improve our oncology services, and these are all services that take place in higher levels. And then, of course, within prioritizing the budget for this financial year, we had to assign funding rather to those areas because it's existing problems then to primary healthcare. I move on to the question of the backlog with forensic mental observations. Now, the backlog with forensic mental observations is a problem of the South African Police Services and the Department of Justice. The Department of Health's role there is to provide them with health facilities where these observations can be done, because even the staffing is provided by the Department of Justice, and we do complement, we do assist when they struggle to supply psychiatrists and psychologists from the state, because there's usually a panel in terms of the forensic observations. Strides have been made between the three departments and the backlog has been reduced. But Chair, the backlog will never disappear, because in the past 24 hours, and as we speak now, people are being admitted into prisons for crimes, and this is a continuous thing. And therefore, we work to reduce the turnaround time, but there will always be a backlog in forensic observations. The next question, I think Dr. Tulari did address about shortage of medicines in any facility, whether it be a hospital or a clinic. We do not have a general problem with medicine availability in South Africa, but if certain areas have problems, we'd like to get those hospitals and clinics by name so that we can find out how they should, what their specific problems are and how they should be assisted to address these. Yes, our facilities are quite ready for the rise in non-communicable diseases. And I say this because the screening for, the early detection for non-communicable diseases as part and parcel of the training of our community health workers who go out in the community to proactively advise people on healthy lifestyles and to refer them to the primary healthcare facilities. Also, our staff through the adult primary care course that speaks to integrated training with regard to South Africa's burden of disease. Staff also get trained on early detection and management, and also giving health education in terms of that. We are, through the health promotion levy, supplying equipment for early detection. And as I said, the staff training is being scaled up in terms of early detection, proper management, and referral to higher levels where needed. There was a question, Minister, on the administration of the Northwest Department of Health, and I'm responding to it since I was the administrator. The Department of Health did a close-out report to the chairperson of the team that was leading the intervention into that province, and I know the Departments of Health's close-out report was part of a final close-out that did go to the NCOP. As we speak, the Department of Health in the Northwest is under Section 101A, and we are awaiting the guidance from the NCOP in terms of whether we will finally end the administration. Thank you, DG.
Thanks, the last one, CFO, and then we'll hand back to the Minister.
Yeah, no, thanks, DG. I think just the emphasis on the question that you already indicated, DG, that you already answered. Just to add on it, that we also do have the CFO forum, which they are representative from all the provinces, which it does support the CFO forum, where we have all the CFOs in the provinces, where we discuss all the audit plans, we review them, and we make sure that we improve all the activities. As we have already indicated, we did have the 10 by 10 this month in April. We also did have the CFOs forum and the SCM in the preparation of the audits for this month, as the AG is there. But mainly on the 10 by 10 with the AG, we also discussed where there are inconsistencies in terms of audits in the provinces, and also including the methodologies that the AG applies in different provinces. We also do the monitoring of the conditional grants in the provinces through the team, which we do continuously on quarterly basis and also annually. We also do have the, I think it's those ones, teaching. Then the other ones, they have answered them, but just the one on the PHC, just to indicate that the total funding for the PHC in the country, it's sitting around 114 billion, which it represents around 48 to 50%. But DG Annette has already answered some of the questions related to that. Thanks, DG.
Thank you very much. Last one before I hand over to the Minister is on the obstetric surgeries backlog in Robert Sobukwe. I would like to request that, because we need a bit of more detail from the province, we can then send it in writing to the Parliament. I've been trying to call the acting HOD there and I couldn't get through to him. May I hand over back to the Minister and the Deputy Minister?
DG, before you go, there was an issue of the forensic chemistry laboratory. There's been challenges there, backlogs of processing of samples. Honorable Bacha wanted to know whether there's any progress. I don't know if you do have somebody from that section who can give us an indication of progress at the forensic chemistry laboratory.
Yes, we handed over forensic chemistry laboratories more than a year ago to NHLS, and according to the information at hand was that would like to know if there are any specifics, because they've said they've actually improved the processing of specimens there within the forensic chemistry lab. But again, we will get more latest report from National Health Laboratory Services. Thank you, Minister.
Okay, no, thanks. Yeah, I think we can come back to the chair on those two issues. NHLS must still give us feedback on on the forensic chemistry. Honorable Chair, also respecting the time you've allocated, that concludes, but maybe let me just ask before I give back to you, if Deputy Minister might want to comment on some of the issues which have been raised before you take over, Deputy Minister.
No, thank you very much, Minister, and good afternoon to the leadership that is here from the NCOP and the DG and the team. Just one comment on the issues of Robert Mangaliso Hospital. We visited Kimberley, Honorable Christians, 2 weeks ago on a program that was focusing mainly on the target population, the youth, LGBTQI. So we just made a pass through Robert Mangaliso Hospital. And one thing that I picked up there is that they do have what we call suggestion box, where some of the members of the community, if they have certain ideas, things they are happy with or things that they are not happy with, they throw it in that box. And I just checked their regular opening of that box. So I would encourage that maybe we also find time to encourage our members, honorable members here, to encourage the citizens to really make suggestions of improving where we have facilities and challenges. One of the things that was raised by Honorable Christians is what are we doing largely with regards to the NCD, the non-communicable hypertension, diabetes. I would have probably asked the member to say, what can they assist us with? Because the issues of non-communicable diseases is a behavioral change. To say, can the department support us with more information how, when we are in our constituencies as honorable members, speak to our members about actually living a healthy lifestyle, exercising regularly, reducing smoking, reducing drinking, alcohol, and maybe doing things like those, because that can go a long way, honorable Christians, if it is done by you in the community, hoping that another member also will do the same in his or her community, and all of us then can be able to reduce the intake of salt in our diets and all those issues, because it all starts with that. It's the education that we can give in clinics, hospitals, but members of the society, leaders like the members here, can go a long way to really even encourage that type of a behavioral change, which will impact positively. So maybe we could provide, if it is acceptable, members of the select committee, because they are very close to the issues of health and lifestyle and such behaviors, with information that could encourage them to do and lead such campaigns in their various communities. Thank you very much, Honorable Chair, and thanks, Minister.
Thank you very much, Dinawa. Chair, before I hand over to you, there was just a quick response to Honorable Lutuli had asked about how do we prevent further strikes. Well, while the freedom to strike and to withdraw labor is part of our dispensation, constitutional and legislative, but what we have also, what has been emphasized in the last strike, it's also the fact that that law also protects essential services. And what is required from us as the people in charge of these services is just to make sure that we implement that those provisions. And as you've been aware, the Appeal Labor Court did re-emphasize the fact that the people on the front line of essential services are not allowed. So if they do get into a strike, it should be declared as an illegal strike and must be dealt with. But of course, beyond that, some of those are beyond ourselves as the health, but together with other colleagues in the government, we have to make sure as much as possible that issues which lead to such grievances are avoided. But it's almost impossible to satisfy all the unions. So ultimately, for us is to also, on behalf of the vulnerable public, to use the legislative tools available to us to give a counter incentive for the workforce to go on strike instantly when there is any disagreement. Back to you, Chair. Thank you very much.
Thanks, Honorable Minister, and the department for the elaborate answers to the questions. And thanks also to know that you are paying attention to the questions that we're asking. That is not just responding whether you are happy with the answer or not. The question is answered. We have moved on. And that your attitude is that all questions must be answered, and the answers must also make a lot of sense toward resolving the problems that we are dealing with. Thank you very much for paying attention to our questions, and that some of the outstanding matters that were raised, maybe there could be even others that will be raised in our correspondences with you between now and the next meeting, and that will be sent through our committee secretary. Yeah, in those words, let me say thank you to the DM, the minister, the DG, all top management in this meeting. Thank you very much. Till we meet again in the next meeting. I'll release you, but the meeting will continue for some time with the members so we can do our little administration as the committee. Thank you, Honorable
Thank
Minister.
you very much, Chair.
Thank you, DG.
Yeah, we can the team please exit? Let's all exit. Thank you.
Bye, dankie. Relebo. I can see it. Amanda. That's minutes of the members meeting of the minutes of the 25th of April. Yeah, thank you, Marcel. Are there additions, questions in the minutes? If none, can one of the members move for the adoption of the minutes?
Ndongeni moves for the adoption of the minutes, Chair.
Yeah, Ndongeni moves. Any seconder?
Lisha. Nkosi seconds.
Nkosi second. Honourable members, before we go, there is a meeting that I had a discussion with Marcel about the meeting the APP and a budget of Stat SA. You remember this year we're going to the budget of the Stat SA budget will be debated. The vote will be debated in the House. Marcel, do you have something to announce or to say on this matter?
Good day again. Thank you, Chairperson. Chair, I am in contact with Stats SA. I am waiting on them to confirm whether or not we are able to meet on Friday, the 5th of May. I am waiting to confirm, Chair. As soon as I know, I will let the committee know. Thank you, Chair.
Yeah, well, members, it's important that we discuss this matter. I mean, have a meeting with them because we were supposed to be meeting with them, but now they are having an engagement in the National Assembly on their budget. Yeah, we'll get information from the committee secretary and the team about way forward on this meeting. So thank you very much, honorable members. This meeting is adjourned. Bye, thanks. Bye-bye.
Thank you, Chairperson. Thank you so much.
Thank you.
Thanks, Chairperson. Bye.
Bye.
Bye-bye.